Preparing college students to manage health matters on their own. A physician shares some 4 crucial tips before the kids leave your nest.
Well, with 1 month now until students head to college, it's pretty easy to get caught up in all the back-to-school shopping and the excitement of the freshman year. But one important issue that is often overlooked is the fact that your child will need to manage his or her health on his or her own for the very first time. So here to help get the conversation started is the author of Healthcare Navigation 101, a guide for college-bound students, Dr. Nicole Rochester. Good to see you.
Thank you. Nice to be here.
Yeah, so this is an important conversation that maybe we haven't thought about talking to our kids about. But you were telling me you have one in college, and you did have that conversation.
Yeah, I do. I have a daughter who is a rising sophomore in college. And when we were preparing her to go off to school, we got caught up in the shopping for the dorm and, decor and all those things. And I realized as a pediatrician, wait a minute, there are a lot of more things that she needs to know. And so as I was preparing her, I thought more people need to know this information.
All right, so if you're at college and you get sick, obviously you go to the campus clinic.
Yes.
I mean, it's kind of like going to the school nurse, right, in high school.
It is, to a large degree.
I think most kids know that that's available on campus. What else do we need to know about?
Well, I think a lot of students are not familiar with just navigating healthcare in general. I mean, of course, we adults struggle with navigating the healthcare system. And while the Student Health Clinic is an absolute wonderful resource, sometimes they may need other resources. Maybe the Student Health Center is closed. Maybe their illness is, more acute, or maybe it's more serious and they may need to seek care elsewhere. And we really don't do a good job preparing our students for that transition.
Part of it is, figuring out, am I sick enough that I need to go and see a doctor? And, what do I do for, how do I make an appointment? Maybe the kids have never done this kind of thing before for themselves.
You have hit the nail on the head. So for the first 17 to 18 years of their lives, we parents are coddling them. We are the ones that are deciding whether they're sick enough to go to the doctor. We're making the medical appointments for them. We're speaking up for them in the office. We're picking up prescriptions. And so they've never had an opportunity to practice these really important skills on their own. Then we send them off to college and expect them to be able to do it all on their own independently.
Right. And then when they get to see the doctor, just telling important information, maybe your medical history,
yes,
or just certain symptoms you may be having, just sharing that information with the doc.
Very true. And it can be really difficult for young adults to communicate effectively with healthcare providers. Some of them may be intimidated. Many of them have not had the opportunity to practice those skills. So that's why I think it's really important. And those are many of the tips that I have in my book.
So parents really need to make sure their child does have that medical history to bring with them.
Absolutely. That is one of the most important things. I have found that most students don't know their past medical history. They may not have remembered that they had a surgery when they are 3 or 4. They may not know that they're allergic to a particular medication because, again, the parent is usually in that exam room speaking up on behalf of the child. So it's incredibly important that parents begin to teach the kids and that we talk to our students before they go off to college so that they are armed with that information and they can be independent.
And then the biggie, how to pay for it, and is my insurance going to cover this office visit on campus?
Huge, huge, because a lot of parents erroneously assume that their health insurance will cover their child when they go off to college. And the reality is that if they are out of state, they may have no coverage for non-emergencies, or if they do have coverage, they may face huge out-of-pocket expenses.
Yeah. All right, you say put together a first aid kit for your kids going off to college. And you've brought a few things here to put into the first aid kit. What should everybody's first aid kit have?
So it's very important that you put the things that your child needs. So it should be customized, based on the symptoms, based on the underlying conditions that your child may have. But every student needs a certain number of things. So digestive aids, so, things for constipation, things for an upset stomach, a multivitamin. They're not getting sleep. They're staying up late studying, so this will help with their immune system. They're going to get little cuts and scrapes and things like that, so they should have material. Yeah, Band-Aids, antiseptic wipes, antibiotic cream or ointment to put on that cut. Every child is going to have a cold. They're going to get sick within the first
Especially
month or
in a
two.
dorm.
Absolutely. All those germs, close quarters. So they should have cough and cold medications. They should have
And it's good to have it on hand, so you don't, you're feeling terrible, you don't have to run out and try to get it.
That's exactly right. And these things can be really expensive, so you might as well just have them in the dorm room so that they have it readily accessible.
And something for allergies.
Yes, especially in this area. Allergies are really bad, and so you want to have something for allergies, and also a thermometer. You know, every home needs a thermometer. Putting your hand on your forehead is not adequate. So they need to be able to measure their own temperature so that they know just how sick they are, whether they need to go see the doctor.
Very good. And remember that mom is not here. You cannot run to mom's medicine cabinet and get your aspirin or your Tylenol. You have to provide it yourself.
That's right.
Your book, tell us quickly about your book.
Yeah, the book is called Healthcare Navigation 101, a guide for college-bound students and parents. It's available on Amazon. It is a wonderful guide for the student and the parent. Walks you through communicating with the doctors, the questions that they ask. There's a nice resource for documenting their health history so that they can fill that out before they go off to college.
All right, great resource. Thanks so much for coming in.
So much
Nicole
for having
Rochester, physician and health advocate. We appreciate your time today.
Thank you.